Hey, Doc, welcome to the show.
Oh, thank you so much for having. It's been like I've been waiting for this moment for such a long time. So
Me
I'm so
too.
happy to be here.
Yeah, me too. And I was telling you offline that thank you for being flexible because for the audience who's not aware of what we're talking about, we were scheduled, I think, in August or July, and I got COVID. My mentor, Dr. Pompa, gave me COVID out of all people, right? And I messaged you. I'm like, dude, I can't make this podcast. And you sent me all this amazing information and you sent some supplements and your amazing book. So thank you for being so generous. And I'm glad we're back and we're doing it now. So I'm pumped about that, Judson.
Absolutely. Well, you know that I have even more to talk about now.
Ooh, yeah. So it was a perfect timing. And
Exactly.
man, like for those watching on YouTube, you got to look at this book that I'm holding in my hands right now. It's about 900 pages. But don't get scared if you're not a reader because it's so well written. You collaborated with 50 doctors. So it's called The 21st Century Man, and it's available on paperback, Audible. How long is it on Audible, by the way? I'm just curious, time
Oh,
wise.
it's like 40 hours.
Did you
It's really
narrate it?
good.
How, did
I
you?
narrated about a sixth of the book. So there's a narrative that I have that goes through the book. That's kind of the hero's journey. And I do introductions to each section because it's important for me. Like I handpicked each author and I handpicked the chapters to create kind of a narrative for midlife men, right? So there's aesthetics and there's addiction and there's exercise and there's nutrition and there's sexual health and urology and specialty health. So I mean, there's a whole narrative that goes along with the book. And so I was the one that did the audio for those things, but the rest of the chapters, it was too much.
That's a lot. Well, congrats because and good job to you for even doing that. I know what a pain in the butt it is personally when I recorded my audiobook for my book Keto Flex. It's like 7 hours, 6 hours, but oh my gosh, I had no idea what I was getting myself into. And the fact that yours is that long, I love that you offer that though, because some people are more listeners. So if you are on Audible, go get the book and just chip away at it. You're going to learn so much. And yeah, it's even much more than what you just said. You talk about gratitude and journaling and all these things that I love. And we'll get into that for sure. But, share your story because this is the first time you're on my show. Some of my audience members might be new to you. So I know you are a rock star in the men's health space and the health space in general. But maybe if you could share your hero's journey
Yeah,
and how you got.
so I am an interesting cat. So I grew up in New York. I went to Brown University. I was a history major, but I always knew I wanted to go into medicine. After undergrad, I did a year of research at American Red Cross in Rockville, Maryland. I worked for Harold T. Merriman, who was the guy that figured out how to freeze blood. So you can't
Wow.
just take blood and throw it in the freezer. You have to prepare it so that the red blood cells don't pop. And Harold figured that out and saved, untold numbers of people's lives by figuring that out. Then I went off to Vanderbilt for medical school, took a year off during medical school to do Howard Hughes Medical Institute sponsored research at Harvard Medical School on transplantation immunology because I was really interested in kidney transplants. And that's where they did the first successful living related kidney transplant and won the Nobel Prize for that. And then I
Wow.
went back to Vanderbilt, finished up medical school, and then I went off to UCLA and did 2 years of surgery and 4 years of urology. And part of that, I also did research with Mark Litwin in health outcomes and prostate cancer, and then went into private practice and helped build robotic surgery. So we had the second Da Vinci surgical robot in the country, and I helped pioneer surgical robotics. I built the Kidney Stone Center. I helped pioneer MRI-guided prostate biopsies. And then about 3, 4 years ago, I became really interested in regenerative urology. So the ability to help men who have lost blood flow to the penis restore that blood flow through shockwave therapy, PRP, and a bunch of other stuff. And then I got into hormonal therapy and I got into physical rejuvenation. I work with BTL on their M-Sculpt and M-Cella. I do clinical research and write books and do podcasts. And it's a lot of fun. Every day is like a new day at work. Trying to figure out what we're doing that day.
That's really impressive. It sounds like you went to school for 20 years. How long were you in school for?
Oh gosh, I finished residency when I was 33, 32,
Wow.
33, something like that. Yeah.
Well, that's impressive. I love how committed you are. Not a lot of people would do all that. Were you always like that growing up? You were just like somebody who was just like,
I'm always been a hard worker. I was a triathlete, I was a runner, and I never minded sort of the grunt workout. I could always outwork. I might not be able to beat you in a sprint, but I keep going and I'll get you at the finish.
It's a great quality. And what gave you the idea to write this beast? They call
Oh
it
man,
the Dude
COVID.
Bible. We'll call it, huh? COVID did. Okay.
Yeah, COVID.
What a
You know,
blessing.
I had restarted my practice. I went from a general urology practice to just a private pay men's health, men's sexual health practice, and then COVID shut my practice down. And I'm not one of those people that just sits around and watches TV. And so I
Get
thought, well,
out.
let me just write a little book about sexual medicine. And then as my patients were coming in, they would say, well, I'm not a good sleeper. And if you're not a good sleeper and you don't get into REM sleep and you don't get nighttime erections, that can affect erectile function. So I'm like,
Mm.
well, we need a chapter on sleep. And then I have patients, with heart disease and that affects erectile dysfunction. So then I got cardiologists to write about that. And so it just kind of built on itself. And then, if your relationships are crappy, if you don't get along with your spouse, you're not going to be physically intimate. And so, I said, well, we need a section on relationships. And then if you're depressed or anxious, so then I was like, well, we need a section on mental health. And then, the end, there's an amazing chapter on inspiration written by Brian Bandmiller, who's a national news correspondent who's interviewed every president and business leader. And then there's a great chapter on gratitude, which is really, to me, an essential component of living a good life. And then a friend of mine wrote a chapter on legacy, my business advisor, which, at the end of all of this, I mean, think about how many thousands of people, you've helped lose weight and really turn their life around. And your books and everything, you've left a tremendous legacy that people will remember you about. And I think that's important for all of us going through life. You don't want to go through life and just take. You want to give. You want to have something that people can remember you about.
Mm. Amen. I love that you have a chapter all about gratitude. I'm all about that, and we'll talk more about that later. I call it vitamin G, the strongest vitamin in the world. I have T-shirts that show vitamin G on it. It's just so powerful, and it's free, and you can't overdose. But I want you to make the case, because I was telling you before we hit record that unfortunately, out of the 500 episodes that were in with the Keto Camp podcast, less than 10 of them have really been focused on men's health. And there's a crisis, and I want you to share some of the stats out there. But why is this so important to you? And for the woman listening, why is it important for her to stay on this podcast and listen the whole way through?
Yeah, I mean, men's health in this country is a catastrophe. So 100 years ago, men used to live 1 year less than women. Now men live 5 years less than women.
Wow.
Right. So, it's a deterioration. And even before COVID, the longevity of white middle-aged men was declining. And it was declining because of alcohol, because of suicide, and because of opioids. I mean, how sad is that? And men are half as likely to go to the doctor as women.
That's true.
There's this ethos that, we're tough, we can take care of ourselves, but, sometimes you can't. And you have to learn how to take care of yourself, because what you're doing in your 20s and 30s, when you feel like you're invincible, have consequences in your 40s, 50s, 60s, and 70s. You don't want the 60-year-old you looking back on the 30-year-old you saying, dude, you really messed me up.
Mm.
You want the 60-year-old you saying, thank you so much. You really started eating better. You started exercising. You stopped drinking. You stopped smoking. You really started taking care of yourself. And because of that, when I'm 60, my erectile function's good. I'll be able to run around with the grandkids. I'll be able to travel. I'll be able to enjoy life. But it's really the health habits that you get into in your 20s and 30s and 40s that shape the whole rest of your life.
That's a great explanation. Looking at your future, your 60-year-old self, and what kind of conversation are you going to have? Is it going to be, a happy one? Thank you so much for taking care of your body. Or is it going to be one of regret? Because you're right. It's these accumulated hits that we take over time, and you might not feel it right away, but over time, you better believe the compound effect is both positive or negative, depending on what you feed into. Now, what about the woman listening to this show right now or watching on YouTube? Why should she stick around for the whole episode?
Yeah, so a lot of the stuff we're going to talk about relates to women also. I mean, a lot of the things that keep men healthy also keep women healthy, but men are half of the planet. And uh, happy wife, happy life, and that's
Mhm.
such a trite expression, but I have to learn it, relearn it like every week or every day. But at the same time, if your husband's pissed off and grumpy, it's going to make your life miserable. And there are really some gems in the book. So there's one chapter on what you can do as a woman to support and help your husband. There's another chapter in the book, which I've never seen written in any men's health books or magazines, which is what men need to know about menopause, right? I mean, you're 55, your husband's 55, everything's going great. And then all of a sudden you hit menopause. And if your husband doesn't understand what's going on, your relationship's going to go in two different directions.
Yeah.
But if your husband understands what menopause is all about, that it's hormonal, that it's natural, that it's just part of life, that there are things you can do, if you believe in taking hormones, understanding how the vagina ages and how you have to change your sexual practices based on that kind of thing. If you really understand that, you can continue being sexually active and you can continue that important part of your relationship in your life. And you just have to read the chapter to understand that. And then
Yeah.
there's even an amazing chapter, and that chapter was written by a good friend of mine, Russ Bartels, who's a urogynecologist, amazing guy, and he understands from a male's perspective what men need to know about menopause because he takes care of men and women, and he's a gynecologist. And then there's an amazing chapter written by Susan Bratton, who's a good friend of mine,
Yeah.
who's an amazing internet sex coach and intimate wellness advisor on how to please a woman.
I love it.
You know,
Yeah,
I
well,
mean, I mean, it's worth buying the book just for that.
yeah, seriously. And the book is kind of like, and you could tell me if you agree. You don't have to start. You don't have to read it start to finish. You could kind of just go to which chapter you're most interested in. Is that correct?
Absolutely. I actually put a note when we send the books out telling people read the introduction, read the first chapter of the hero's journey, look at the table of contents, because the table of contents is like 6 or 7 pages, and then pick and choose what chapters you want to read. It's not every chapter is made for every person.
Yeah. And you gave me a nice little note. Very high class of you. I see here. Ben, you are a hero in your own life's journey. I love it. Thank you so much for that handwritten note. Very classy. And Susan Bratton, we love her. We've had her on the show.
Oh yeah,
A few
she's
months
awesome.
ago. She's so much fun. All right, let's talk about erectile dysfunction. What percentage of men in America have erectile dysfunction?
Yeah, so there was a huge study called the Massachusetts Male Aging Study, the biggest study of men in the United States. And what that showed is give or take 40% of men in their 40s, 50% of men in their 50s, 60% of men in their 60s, 70% of men in their 70s have some degree of erectile dysfunction. So basically 50%, half of men over 50 will have some degree of erectile dysfunction.
Wow. So pretty much, so 40% in 40s, 50%. So as you go into each a decade, you actually increase to 10%. Well, in the study. Okay. And you mentioned the role of sleep. You said if you're not getting proper REM sleep, deep sleep, you're not getting nighttime erections, that's a problem. Could you get into that a little bit more?
Yeah, so nighttime erections, the penis is really a tremendous barometer of health. So in your 20s or 30s, every morning you wake up with an erection. Your circulation is great. You haven't developed any atherosclerotic changes, but maybe in your 40s or maybe in your 50s, depending on how you take care of yourself, the morning erections, which are a reflection of nighttime erections, begin to wane, right? And that's your first sign that your circulation isn't as good as it used to be,
Mm.
right? 10 years after you lose morning erections, you'll begin to lose erections, when you want to get them, with your partner, right? And that's another sign that your circulation isn't working as well as it should. So if all you do is just pop a couple of Viagra pills, you're missing a huge reminder from your body, which says your circulation isn't as good because 10 years after the development of erectile dysfunction, on average, men will have a heart attack or some sort of cardiac intervention, stroke, angioplasty, something, right? Because the arteries going to the penis are 1 or 2 millimeters, and they're out in the periphery. So they're going to get clogged 10 years before the arteries to the heart which are 3 to 4 millimeters and are more central.
Mm.
So if you just, go to get Roman or Blue Chew or whatever and get your Viagra and don't listen to the message that your body is sending you. Your body, your penis is like, it's got an on switch and an off switch. If it's in the off position, call in the technician. You got to take that really seriously. And if you don't, you're going to get a heart problem. And the problem is the first sign of heart disease in 25% of men is sudden death.
Jeez.
Right? So that's like, it's not like a video game where you can put another quarter in. That's it. I had a patient, 47 years old, and he came with erectile dysfunction, and it had been going on for 5 or 6 years, and he thought it was related to, having a kid 5 or 6 years ago. And I said, no, dude, he was South Asian. So Indian people have a higher level of atherosclerotic disease at a younger age. I said, you need to get a heart scan. And you need to change your diet and your exercise, so on and so forth. And so he changed his diet, changed his exercise, but he didn't get the heart scan. 2 months later, he was riding his bike, had a heart attack.
Mm.
Fortunately, he had listened to me. He called his wife. They got him to the hospital right away, and he didn't have any permanent damage to his heart muscle. But that's a possibility.
Yeah.
And there's a possibility that he wouldn't even make it off the bike.
That's wild. So when you say get a heart scan, are you referring to a coronary artery calcium score?
Yeah, exactly. It's like $200 in my neighborhood. And, I live in an expensive neighborhood. It takes 1 minute and it gives you a tremendous amount of information.
Have you seen with those scans, I'm just curious, if somebody has a score of, let's say, 200 or 400, whatever it is, they have some sort of calcium. Have you seen anybody lower that number?
The short answer to that is no, because I send those people to the cardiologist, and the cardiologists kind of do their thing. And then at that point, they're getting angiograms and those kind of things. So they're not getting heart calcium scans again.
Got it. So it's no, but maybe, just not sure because you're not looking
Yeah.
at
I mean, like one of my patients, we got a heart scan on him and he was 800.
Wow.
Right. So 3 days later, and he was 52. Right. And so 6 days later, he had a 6-vessel bypass. You're not getting heart calcium scans anymore at that point.
No.
But for all the ladies out there, if your husband is experiencing erectile dysfunction, it's an indicator that there is underlying cardiovascular disease, right? The penis isn't the only thing in the body whose blood vessels are getting clogged. Blood vessels all over the body are getting clogged. And, for the holidays are coming up, spend $250, get him a heart calcium score, because you may just save his life.
Yeah. And you want that to be 0, by the way. That's the optimal number right there. Regarding erectile dysfunction, what are maybe the top 3 contributors that lead to ED?
Yeah. I mean, so ED is a measure of just sort of general circulation, right? So if you're eating poorly, especially have high cholesterol, then you're going to cause atherosclerotic disease, blockages of your arteries, and that's going to contribute to poor circulation, right? Smoking, you're going to damage the endothelium, the inner lining of blood vessels, going to cause cardiovascular disease. Obesity, right? Obesity does a couple of things. First of all, it makes testosterone turn into estrogen, right? So in the adipose tissue, in the fatty tissue, you convert testosterone into estrogen called aromatization, right? And so a high estrogen, low testosterone ratio is going to change your ability to get an erection. In addition, the fat and the high triglycerides are going to end up clogging the blood vessels, and it makes it much less likely that you're going to exercise. So you live a much more sedentary life that makes your testosterone go down, and your cardiovascular system doesn't work quite as well. And it contributes to type 2 diabetes. And God forbid you get type 2 diabetes. Your life is, your health and your life really, and your ability to get an erection and your ability to enjoy life fully is really tremendously compromised.
It's a great explanation because the ED, the erectile dysfunction, is not the actual problem, to your point. It is a result of the problem. It is a symptom, right? And just by taking a pill, taking something, you're kind of just masking the symptom. You're covering up the check engine light instead of pulling the car over and saying,
Yeah,
what's
it's like
actually
playing
going on?
whack-a-mole. You know,
Yeah,
you
exactly.
hit the mole, right? But the machine's going to keep popping them up.
Right, exactly. It doesn't work. Maybe short term, temporarily, you feel better, but it's not getting to the cause. So the cause you said is multifactorial. It could be smoking, maybe too many LDL particles in your cholesterol, obesity, sedentary lifestyle, type 2 diabetes. So when you address all that, by default, then you actually end up getting the erections and you actually get better blood flow, correct?
Yeah, yeah, absolutely. Absolutely.
So
I can, I I do this thing with my patients. I can tell you how to improve your health in 10 seconds.
go ahead, elevator pitch.
Don't drink, don't smoke, don't do drugs, exercise every day, don't eat too much food, stretch every day, meditate every day, get a good night's sleep, and be nice to other people.
That's good. That's good. I like that. Everybody write that down.
Yeah.
Yeah,
And it's all free.
and it's all free. That is true. That is very true. And you save money because you're not overeating. You're going to save some
Yeah.
money.
And alcohol is not cheap.
That's right. Okay. Now the next topic is a very popular one that I get from men all over the world, and I'm sure you do as well, which is, Doc, my testosterone is low. What can we do about low testosterone?
Yeah. And, as a society, our testosterone is low and it's getting lower, right? So if you look at studies and compare your grandfather's testosterone to your testosterone, it's probably about 30% less.
Damn.
And so there's a couple reasons for that. So first of all, there's all sorts of crap in our food supply, plastics and processed food and all that kind of stuff. And I'm not an expert in that, but I know that it can't be good for us eating all the processed food that we eat. But more important than that, right, is if you're like a hunter out on the high plains and you're taking down wildebeest and buffaloes, you need a lot of testosterone because it's really hard to kill a big animal, right? And if you're a farmer, farmers work really hard. They don't kill big animals, out on the plains, but they still need a fair amount of testosterone to wake up every morning and till the field and deal the livestock. Now, if you're sitting at a desk, especially if you're sitting with a laptop sitting in your lap, you don't need that much testosterone, and your body is really smart. Your body's only going to make what it needs. And your body's saying, well, I'm not hunting any wildebeest and I'm not working on the farm every day. I'm just sitting here, on the computer. So I don't need to make that much testosterone. And then, the reason my testicles are outside my body is because sperm and testosterone production takes place best at 97.1 degrees instead of 98.6 degrees. And now all of a sudden I'm putting a hot laptop on my groin and things aren't working as well from that perspective either. So, guys come into my office that are 35, 40 years old and they have the testosterone of a 75, 80-year-old.
Jeez. Okay. So guys and females, stop putting your laptop on your lap. I know it's called a laptop, but just don't follow that name. Keep it away. I see that all the time and it drives me nuts. Okay. So what are some natural things we can do? I know you already kind of said it in that 10 to 15 second spiel, but maybe you could get a little bit more specific.
Yeah. So, specifically in terms of testosterone, exercise really is critical, right?
What
Because, that's a great question. And any would be,
move your body.
any is better than none. Weightlifting, especially lower leg weightlifting, squats and those kind of things, quads, I think are really good. And then I honestly, I haven't seen a study specifically looking at types of exercise and its effects on testosterone production. But for my guys over 40, I always recommend what I call the ABC exercise protocol, right? So A is for ambulate, right? So walk, run, stairmaster, treadmill. B is for bike, and C is for circuit training. Circuit training is get a whole bunch of different exercises and then doing them repeatedly, right? And the reason it's A, B, C, and then repeat is because once you get to about 40 or 50, it takes you 2 to 3 days to recover. So if you put a really good workout on the treadmill, you're going to need 2 to 3 days of recovery. You know, it's not like my son runs competitively. He can run pretty hard every other day, and he can run every day. I can't do that anymore. I ran competitively, but I need to take 2 days off between running. And, you know, there's a physiologic basis for that. And then you get on the bike. And on the bike, I do high intensity interval training because I just installed the VO2 max machine in my office, and I'm really into boosting my VO2 max. So my VO2 max was 45, which for a 55-year-old is not too bad. But the only way to boost VO2 max is high intensity interval training, where you get your heart rate and your body up to your aerobic threshold.
That's good. And I want to get into the VO2 max a little bit more, but I want to stay on the topic of the testosterone.
Yeah. Okay. Sorry.
Yeah, no worries. Yeah, I'm glad you dropped that little thing because we could let it marinate and we'll get back to it. But testosterone, you mentioned that you have 40-year-olds who come in the office and they have the testosterone of a 70-year-old. How do you test? What's the best way to test testosterone? What else are you looking at? And what are the optimal ranges that you consider optimal?
Yeah. So you can test saliva, you can test blood stick on capillary. But I just had this discussion with a patient this morning. I test blood from a venous blood draw first thing in the morning. Okay. Because the thing is, like, saliva might give you an idea of what things might be. A capillary blood stick might give you an idea. But if you're considering going on testosterone, that's a big life-changing decision. And there are very significant consequences of doing that. You shouldn't just it's not a light decision. Yeah. And so you need a real lab test, and it's got to be done first thing in the morning, because the thing is, your testosterone is highest first thing in the morning, and then you use up your testosterone as the day goes on, and then when you're sleeping, your testosterone recharges. Mm-hmm. Right. And so you have to get enough. If you sleep. Yeah. If you don't get good sleep, then geez, your testosterone is going to be low. And guess why? You're not going to build muscle, because you build muscle when you sleep. You're not going to be psychologically as intact because you process emotions and things that go on during the day when you sleep. Your erections aren't going to be good because guess what? Your body practices getting erections when you sleep. So, 6 to 8 hours of sleep is really essential for health. And if you're not getting 6 to 8 hours of sleep a day, your body's going to break down. It's just one of those things. You can, in your 20s and 30s, and maybe you're in your 40s, you can compensate for that. But in your 40s, 50s, 60s, 70s, you're going to pay the price.
Yeah. And I always tell my students to track your sleep. 6 to 8 hours of sleep is great, but do you know how much REM and deep you're getting? So if you could get 2 hours of each, that would be terrific. But some people might be getting 6 hours of total sleep, but less than an hour of REM, less than an hour of deep, but they wouldn't know unless they're tracking it. So tracking it would be a great idea, because then you can make some changes and see if it improves. I use the Oura Ring to track it, but there's other metrics out there.
But we were talking about testosterone.
Yes.
And lab tests. Okay,
exactly.
So you got to get your total testosterone, right? But more important than total testosterone is free testosterone.
Yeah.
Okay. And so let me explain all this. So your testicle makes testosterone, but it doesn't store testosterone. So the gallbladder, right? The liver makes bile, and the gallbladder stores bile. And when you eat a meal with a lot of fat, the gallbladder squeezes, sends the bile out, emulsifies fat, digests fat, whatever, right? But the testicle makes 4 to 7 milligrams of testosterone a day, but it doesn't store it. It sends it right out into the bloodstream. And the way that your body stores testosterone is it binds testosterone to protein, right? So there's something called sex hormone binding globulin. Globulin is kind of another name for protein. And so testosterone binds to SHBG. It also binds to albumin, which is another protein, but most tightly it binds to SHBG. Okay. And 98%, give or take 1% of your testosterone should be bound. And that way you have a reservoir of testosterone. So if you stop making testosterone, there's still a bunch of testosterone that's floating around. Okay. So you have to measure SHBG, sex hormone binding globulin. And then you compute the amount of free testosterone. So that free testosterone, think about like you have a key, right? That key can open a lock, which is a testosterone receptor, and cause changes in a cell that relate to the function of testosterone. Now, if you took that key and you stuffed it into a big wad of clay, then the key wouldn't work anymore.
Mhm.
And that's what sex hormone binding globulin is. But eventually that key can work its way out of the wad of clay and be used to open up a lock. So total testosterone, SHBG, free testosterone. Now, there are a couple other things that we check sometimes. One is LH. Okay, LH stands for luteinizing hormone. So the way that you make testosterone is the hypothalamus in the brain sends a message to the pituitary, which is a little endocrine gland that sits right behind your eyes, right? And that endocrine gland, the pituitary, makes two things. It makes LH, luteinizing hormone, and FSH, follicle stimulating hormone. In women, same thing. That makes LH and FSH. Now, in women, FSH causes ovulation, and LH, I think, makes estrogen. But in the man, LH makes testosterone, and FSH tells your body to make sperm. Okay, and there's a feedback loop from testosterone back to the pituitary and the brain that tells your brain when to stop sending the signal to make more testosterone.
Mhm.
So we can tell why you're not making enough testosterone based on LH levels.
That's good. Yeah, no, it makes a lot of sense. You might, for those listening and watching, you might need to rewind that. So as you can see, it's not as, unfortunately, as simple as just getting a total testosterone and saying, "Oh, I want to go on testosterone injections," or that's a bad idea to do that based off of one marker. Get all those markers: total testosterone, free testosterone, sex hormone binding globulin, luteinizing hormone, and follicle stimulating hormone, and have somebody like Judson here review it and make sure things are in the right range, because it's such there's a lot of moving parts here, similar to cholesterol, right? It's not just total cholesterol; it's like
Absolutely.
everything else that goes in between. Anything else to add to that?
Well, so I see a lot of guys coming from these like online testosterone clinics or, fly by night clinics run by people who don't quite have the training that they should to advise people on testosterone, because there are a lot of consequences of testosterone if you don't know what you're doing. And a lot of folks are out there just trying to make a profit off testosterone, because testosterone is an amazing hormone and it makes you feel amazing when you take it. Any guy with a bat and two balls is going to do really well on testosterone. But I've had patients come into my office with complete infertility. I've had patients come into my office with a totally destroyed hypothalamic pituitary testicular axis. I've had patients come into my office with liver damage from testosterone. And there's like this whole gym culture, bro science thing where they're getting their testosterone from Mexico or wherever they're getting it from. And it's a problem. And part of the doctors are part of the problem, right? Because we're afraid of testosterone because we don't want to be the doctor that gave Barry Bonds or Lance Armstrong testosterone. We don't want to end up, when a doctor ends up on the front page, it's usually not a good thing. And so I actually wrote a bunch of ebooks that are free. If you go to my website, brandeismd.com, and go to the media tab and drop down to ebooks, I wrote about testosterone ebook. I wrote one on performance enhancing drugs because I saw a lot of guys getting messed up by bro science, and we're taking, Deca and Anavar and Winstrol and all these things. And they were throwing these names out and I was embarrassed. I didn't know what they were. I
Yeah.
didn't, I knew what they were, but I didn't really know what they were. And so I went through the trouble of kind of understanding what they were. And I wrote an ebook that kind of explains the whole framework of what these medications are. And then I wrote another one on testosterone levels, right? So I try to go out there and find the information in it, but if it's not available, if no one's ever written a book about it before, then I have to end up writing it. And so there's another one that's called Testosterone Levels. That's a free ebook on my website that talks about the levels that you get, whether you're doing creams or shots or pellets or oral or sublingual or nasal. I mean, there's so many different ways to replace testosterone, and it's really bewildering. But this book kind of puts everything in a global perspective.
I love that you wrote those ebooks. So go check them out. We'll drop a link down below. I remember I used to own a CrossFit gym here in Miami, and all those things you mentioned were very common with those doing CrossFit. These bodybuilders, not really bodybuilders, but CrossFitters. One of them was Clomid. Are you familiar with Clomid?
Yeah, I use Clomid on almost, see, that's another thing, right? So Clomid is called a SERM, selective estrogen receptor modulator, right? And so on my young patients that I don't want to put on testosterone replacement because it's going to make them infertile, I'll put them on Clomid because that will artificially boost their testosterone because they're not getting the negative feedback loop. But on all of my patients, or not all, but most of my patients that I put on testosterone, I also put on a small dose of Clomid, because what that does is it blocks the negative feedback. And so the testicle now is still making testosterone and sperm. So if you're on high doses of testosterone, your testicles are going to shrivel up,
Mm-hmm.
right? Because your testicles are like, well, someone else is doing my job, so I might as well just, go to Miami and hang out on the
Right.
beach,
Yeah.
right? And
So
this lesson got driven home because I had this one guy came in for a vasectomy, and he was this ex-raider, like just a giant of a man, and he had testicles the size of peas.
damn, that's not good.
Yeah.
Well, that's different than the people who used to come to my CrossFit that I heard who were taking Clomid. They were getting it from a website in India. They weren't on testosterone. They were just administering to themselves. What that's problematic, would you say?
Well, I mean, the thing is, like, you work so hard going to CrossFit, doing like flipping tires and ropes and all that stuff. And then you're going to put something in your body that you're getting from someplace in India?
Yes, exactly.
Like, seriously, there's like some sort of discordance there.
Yeah, it's like
I mean,
common sense.
really?
Yeah. Are you looking to follow the ketogenic diet, but you're unsure how to get started? I'm gonna be hosting a free 7-day keto kickstart challenge where I'm gonna be teaching you our 4-pillar framework to mastering the ketogenic diet and intermittent fasting. In this 4-pillar framework, I've taught thousands of people how to achieve amazing weight loss, reduce inflammation, and get rid of all the symptoms they were experiencing. Whether it's Jasmine, Diana, David, or Sander, so many people have achieved their health goals by doing exactly what you're gonna learn in this free 7-day keto kickstart challenge. This is really the information that I wish I had back when I was starting my health journey, when I was obese as a 24-year-old. If I had this challenge, it would have put me in the right direction right from the start. I mean, can you relate to going on Dr. Google looking for strategies for weight loss, for health, for energy, how to get better sleep? It could be such a strenuous process. Not knowing which foods to eat, what are the best foods for energy, for fat loss, for vitality, how to pair fasting with keto, and how to do it for results that you see right off the bat. And that's exactly what we're gonna be talking about on this free 7-day Keto Kickstart Challenge. So I hope you can join to learn this 4-pillar framework from myself and the Keto Camp team, which is something we normally sell for over $3,000, but you can get access to this 4-pillar framework for absolutely free. These are the exact strategies you need to make this year your healthiest and best year yet. So click around this video, visit the website, and I can't wait to see you on this 7-day Keto Kickstart Challenge. Okay, yeah, you make a good point there, right? It doesn't make any sense, but people want to just do whatever they want. Let me ask you this question: testosterone therapy, fact or fiction? If you go on testosterone, you have to stay on testosterone for the rest of your life. What are the nuances with that statement?
Yeah. So, I mean, so it's basically, it's kind of not true, because a friend of mine, Jesse Mills from UCLA, did some studies showing that even if you were on testosterone 5, 7, 10 years, if you went off of testosterone, eventually your testicle would pick back up and start making testosterone at a reasonable amount. But not everyone
Okay.
gets their testosterone back to normal, and it's probably not going to be at the levels that you were before. But the thing is, you can take something simple like Clomid, and we sell Clomid in our office for $1 a pill.
It's cheap.
It's cheap, and there are basically no side effects from it, and it can protect testicular function. And if you're interested in fertility, there's something called beta HCG, which is a synthetic analog of LH and FSH. that will do an even better job of stimulating testosterone and sperm production. So, the thing is, that's why I made these ebooks, because I don't want guys, who get sold this stuff at the local gym to then 7, 8 years later find out that they're infertile.
Yeah.
Or find out that they have to take this stuff for the rest of their lives because they're the one out of 4 or 5 people that the testosterone just never came back. So,
Yeah.
my ebooks I write, it's not See Spot Run. It's somewhat technical, but I believe that people are smart, and I believe that people, if they really want to learn this stuff, will learn it. I mean, keto is not simple either, but if you put your mind to it, you can understand some of these scientific concepts.
Absolutely. I have a question on luteinizing hormone and follicle stimulating hormone. What are your thoughts on a man who has really elevated levels of both? What's happening in that situation?
Well, it's kind of like the end of a horse race, right? You're coming down the stretch, and the jockey's just whipping the horse as hard as he can to see if they can get the horse to run faster, right? That's what your brain is telling your testicle. I'm sending as much signal as I possibly can because your testosterone production isn't as high as it should be, or your sperm production. So, for example, someone who has infertility is going to have really high levels of FSH because the brain is saying we need to maximally stimulate the testicle for making sperm. And same thing with testosterone, right? That's one of the reasons we know that there's what we call primary testicular failure, is if the testosterone levels are low, but the LH is high. So if the LH is high, you're maximally stimulating the testicle, but the testicle is not making enough testosterone.
And there's many causes to why that might happen, which is what you said. It could be smoking, sedentary lifestyle, obesity. But is there one that's like the main one that you've seen out there that causes that?
Um, there's really a wide variety of things. I mean,
Yeah.
you can get things like mumps, so some diseases, you can get infections, you can get trauma, you can get trauma from bicycle riding, trauma from football, testicular cancer. There's you can have undescended testicles. So there's a whole kind of laundry list of things that it could be.
Yeah, you've probably seen it all as well.
I've seen a lot of stuff.
So you mentioned exercise for testosterone, weightlifting, especially lower legs. You had your ABC protocol. What else are some of your favorite ways to naturally boost testosterone? I know you also have some products you sent to me as well. Can that also help with testosterone?
Yeah, so I created. I have a supplement line that we sell at Affirm Science, and I work with a urologist who's also one of the top nutritionists in the world, who's a professor at University of Michigan, and I created supplements that really, a lot of these supplements have like 20 ingredients. My supplements have like 4 or 3, right? Just take the stuff that actually works, that there have been scientific research on, and then just put that stuff in, and don't put all the other stuff in. So in our testosterone boosting supplement called Support, which is available at affirmscience.com, there's DHEA. So DHEA is a testosterone precursor. Your body uses DHEA to make testosterone. Now, the knock against using DHEA was always that it also converted to estrogen, right? Because testosterone and estrogen, right? So men are from Mars and women are from Venus, but testosterone and estrogen are only different by one single hydrogen atom. So they're almost virtually identical. And so it's easy for your body to aromatize or to flip testosterone into estrogen. And so we put DIM in there, and DIM blocks the conversion of testosterone to estrogen. Now, the other thing we talked about is binding to sex hormone binding globulin. And it turns out that there's something called Tonkat Ali, which is an herbal, a botanical, that will bind to sex hormone binding globulin. So you get a higher percentage of your testosterone that's actually free. And then there's another substance called ashwagandha that's been shown to boost testosterone levels as well, right? So that's it. That's what's in Support. And so you can expect Support will boost your testosterone level 10 to 20%.
Wow.
Right. And that's as good as it gets in terms of a supplement. So all these supplements out there making these outrageous claims that, you're going to roar like a lion and all that kind of stuff is just a bunch of crap.
Yeah.
Realistically, if you look at the literature, if you look at the science, support has the ingredients that will boost your testosterone 15%, maybe 20%. If your testosterone's low. Now, if you're coming in with a testosterone of 6, 7, 800, it's not going to do much, right? Because you probably already have decent levels of those things. So this is only for guys whose levels are kind of low. And if you want to get to high levels, like when I replace testosterone in my patients, I get them to between 1,000 and 1,200, right? Because that's the level, right? Yeah. So that's the level you are when you were 20 and you feel like you're on top of the
level
world.
that you would say would be an optimal level. 1,000 to 1,200 is what you consider.
That's what I get my guys to.
Okay.
Yep.
Interesting.
And that's not always the way I thought. When I was doing general urology, I was trying to get, just what we call it, eugonadal, getting between 500 and 600. That's going to be great. But you know what? Patients would come back and you'd ask them like, well, how you feeling? I think I feel a little bit better. Right now, I get my guys, they come in 300, 350. I get them to 1,000 or 1,200. And I'm like, well, how you feeling? Oh man, I feel great. I went on a fishing trip and I was able to climb, the trails with my kids, and my libido is back, and I'm in the gym and I'm building muscle, and I'm getting rid of fat. In fact, we have the Brandeis MD Elite Fitness Challenge, and my patients, because we don't talk about weight, we talk about body composition, right? We talk about how much muscle you have and how much fat you have. I never let my patients talk about weight, because I had a patient come in a couple months ago and he's like, doc, I don't think things are working. I only lost 2 pounds. I'm like, so what? Yeah, but I said, get on my body composition scan. Right. Smart. And he had lost 7 pounds of fat and put on 5 pounds of muscle. And I'm like, dude,
amazing.
That's fantastic. He's like 65 years old.
I can't tell you how much that happens with me. Like, the scale's a damn liar. I love that you look at other metrics. I have a couple questions on. Oh, by the way, first of all, before I forget to mention it, so it's affirmscience.com to get that supplement and other supplements. You have supplements for nitric oxide. I've been using that. You gave us a coupon code KETOCAMP to get 20% discount. So go to the link down below. Use KETOCAMP. Thank you for doing that. 2 questions. Are you worried at all, increasing testosterone over 1,000? Are you worried at all that it could potentially signal too much growth, like cancer growth at all?
Yeah. So that's in my ebooks, but the short answer to that is testosterone does not cause prostate cancer. Let me repeat that. Testosterone does not cause prostate cancer. Okay. Fact number 2, men with low testosterone develop prostate cancer at a higher rate and more aggressive prostate cancer than men with normal or high testosterone, right? So testosterone, we're changing the way that we really think about testosterone and prostate cancer, and testosterone may actually be protective against the development of prostate cancer. So, you're at the time of your life when your testosterone's highest is when you're 20, right? And you don't get prostate cancer. When do you develop prostate cancer? When you're 60, 70, or when your testosterone's low. So if you have aggressive metastatic prostate cancer, you probably shouldn't be on testosterone, although that now is coming under
investigation.
Investigation. There's a guy, Abe Morgenthaler. He's at Harvard, and he believes in what's called the supersaturation theory, so that your testosterone will, up to about 200, will stimulate the growth of prostate cancer. After about 200, you don't get any more growth. And so if you medically castrate someone with metastatic prostate cancer, you harm their muscle mass, their libido, their drive, and you may not be doing any more to drive the growth of prostate cancer. But that's kind of going deep into the rabbit hole of testosterone and prostate cancer. But let me just say one more time, testosterone doesn't cause prostate cancer, and low testosterone guys have higher rates of prostate cancer and aggressive prostate cancer than guys with normal testosterone.
That's good. What about other cancers? Would increasing testosterone over 1,000 contribute to any other cancers? Have you seen that at all? Okay.
Nothing else. But the amazing thing is it reduces your risk of diabetes.
Mm-hmm.
That's been shown. It's especially type 2 diabetes.
Is there a relationship between testosterone going up and insulin dropping? What's the connection there?
I don't know.
Because that's fascinating to me that as you increase testosterone, you lower your risk of type 2
But
diabetes.
there are a number of papers showing you reduce your risk, and
I'm
maybe it's
gonna look
because
it up.
you build muscle. When you build muscle, you increase your BMR.
And you're more insulin sensitive too.
Yeah, you're more insulin sensitive, and you drive down your fat. But it also may have something to do with the way that testosterone and insulin interrelate. But I don't know.
Yeah, that's good.
Testosterone reduces your risk of heart disease. It reduces your risk of Alzheimer's. Um, Testosterone is like sort of the magic bullet for men.
I love it. Question on testosterone. What have you seen with boron helping to increase bioavailable testosterone? Are you a fan of boron at all?
I've just become aware, and I'm just kind of diving into the literature. So probably in a couple of weeks, I'll have a better answer for that. But I have heard about the relationship with boron and testosterone.
Okay, well, we'll follow you on social media to see what videos you put out regarding that.
All right, now I'll have to put something up there.
You got to do it now because my audience is going to follow you. What's your Instagram, by the way, so they can know?
It is Brandeis MD.
At Brandeis MD.
I think so. Yeah, or Judson Brandeis. I supply the content from my Instagram, but I'm too much of a boomer. I'm too much of a boomer to know how to put stuff up.
We're at the time of we're an hour in. Do you have about 5 more minutes, or do you have a meeting?
Yeah, we got to talk about P-long. That's my
I want to talk about P-long, but before we do, I want to ask you a quick question on prostate cancer, and then we'll get into the P-long study. Prostate cancer. What's the percentage of prostate cancer in the US?
Yeah, probably about 15% of men at some point will have prostate cancer. But, it's a much
25.
smaller percentage, 15%.
Okay.
But a much smaller percentage will actually die of prostate cancer. So the most common cause of death in men with prostate cancer is actually heart disease.
And then cancer?
Yeah, so a lot of men will die with prostate cancer, not of prostate cancer. And we're getting better and better in learning who actually will die of prostate cancer, because in the past we were over treating men with prostate cancer. Someone coming with prostate cancer, we'd freak out. Oh, you got prostate cancer, we got to take that thing out.
Biopsy or take it. Yeah, exactly.
Yeah, and unfortunately, a lot of guys had a lot of really bad side effects from the treatment of prostate cancer. So now, because of MRIs, and I have a really good chapter in the book on this, because of MRIs, because of genetic testing, because of a lot of studies on watchful waiting, we have a better idea of who to treat for prostate cancer and who not to treat for prostate cancer.
Oh, that's good. That's really good to know. And your Instagram handle is Judson Brandeis MD. Yeah, you were right.
There you go.
There's a gentleman, Spencer Feldman. He came in. I work with Dr. Pompa and a group of doctors, and we mastermind every Tuesday. Dr. Pompa, my mentor, brought him in, and we got onto the topic of prostate cancer. I want to hear your thoughts on this real quick. His theory, I don't know if there's any research to back it up, but one of his theories to why prostate cancer is prevalent in males is that men are sitting down too much and there's not enough blood flow to the prostate, leading to prostate cancer. What are your thoughts on that theory?
Yeah, he's obviously never operated on a prostate before. I can tell you from firsthand experience that the prostate gets a lot of blood flow.
Even with somebody who's sedentary, obese?
The blood supply to the prostate comes off the aorta, common iliac, internal iliac, and then inferior vesical artery and the prostatic artery. And sitting would have no effect on the blood vessels coming to the prostate. The blood vessels come basically internally and up, and sitting would have absolutely no effect whatsoever on blood flow to the prostate.
Okay, well, good. I'm glad. That doesn't mean we shouldn't sit down all day, but it's not contributing to.
Well, I mean, sitting down all day wrecks your back.
Yeah, it does, and not to mention so many other.
There's a great chapter in my book on that, but written by a really good chiropractor. But it doesn't affect your blood flow to the prostate.
Okay, thank you for clearing that up. Yeah, that's good. And it was a theory, right? I'm not saying he had research. I found it interesting. I wanted to ask you. All right, let's finish on. You were just here in Miami Beach a few weeks ago, and you lectured on this P-long study. Man,
P-long.
You're gonna love this part. So go ahead. What does this mean?
Yeah, so I'm the first person ever to have grown a penis in length, girth, and function.
Wow.
and present it at a reviewed scientific meeting, the International Society of Sexual Medicine, where a bunch of odd birds like myself get together and talk about these kind of things. But so to be honest, as a disclaimer, I could care less how long guys' penises are. Um, but I see a lot of guys come into my office as a sexual medicine expert who have done fillers, who have done fat transfers, who've done suspensory ligament ligations, who've had silicone stuffed into the penis, and they have disastrous consequences. And so
Ah,
I said to myself, there's got to be a better way to do this. And as a regenerative urologist, I use a lot of PRP. And so I said, well, what if we took growth factor? We took a traction device, a stretching device, a penis pump, which grows girth, and the Affirm nitric oxide boosting supplement, which increases circulation and helps with nighttime erection. And so I created this protocol and I got it institutional review board approved. So officially done a study. I listed it at clinicaltrials.gov, which is the NIH clinical trials website. I went through a lot to recruit patients. I had those patients get an injection of PRP every month for 6 months and do traction for 20 minutes twice a day and suction 20 minutes twice a day and take my nitric oxide boosting supplement. And at the end of 6 months, the average guy in the study increased his penile length almost an inch, increased penile girth a half an inch, and everyone said that their penis worked better. Right.
wow.
And these are normal, healthy guys, right? They're not guys with erectile dysfunction. So we couldn't really test whether guys were having super normal erections versus normal erections. But, as a guy, you kind of know when things work better.
That is really interesting result. So they were done on healthy men, you were saying. Do you plan on doing this on men who are overweight, obese, to see that sort of population, how this works for them? Maybe there's a bigger increase?
Yeah. So for guys with erectile dysfunction, um, they have other issues. So there are things like shockwave therapy and PDE5 inhibitors like Viagra and the Amcella chair and a bunch of other stuff that we're working with to improve erectile function. But the thing is, you wouldn't want to bother trying to
Yeah, doesn't
increase
make
the
sense.
size of the penis if you're not
You're
capable of
right.
filling it up with
Yeah,
blood.
yeah, you're
So
right.
this is just with, like when they do studies, they're like, how many guys want bigger penises? 50% of people say that they do, and then 50% of the people are lying.
Okay, that's interesting. So that makes sense, though. If you have erectile dysfunction, your goal is not to increase your penis size; it's to get rid, find out what's causing the erectile dysfunction. So I love that. Anything else you want to add to that before we kind of
Yeah,
really?
so it's something that you're interested in, and I'm not convinced. Don't get me wrong. I'm not convincing anyone that they need a bigger penis, that they should want a bigger penis. Um, the size of your penis is up to you. If you're happy with it, fantastic. But what I'm saying is, if you're not happy with the size of your penis, you want it bigger, longer, more girth, and for it to work a little bit better, don't do any of the expensive and dangerous things out there. Just go to p-long.com and learn about a natural way to increase length, girth, and function that's likely to be much less expensive than the other things that are out there and totally safe. And I can give you a reasonable expectation of how well it's going to work. It's going to give you about an inch of length, half an inch of girth, and better function.
Great. Okay. Final question for you, Doc, is around the chapter you have about gratitude, vitamin G. What do you have vitamin G for today?
Oh man, I have so much gratitude for so many things in my life. I mean, I'm just looking outside now and it's a nice sunny day and it's in California. And, I'm watching the news yesterday and people in Ukraine are getting bombed and people in Iran or don't have freedom. So, I'm just grateful for being in this great country. I'm grateful for, our environment and for the weather. And I'm grateful for my wife and for my kids and for my family. And I'm grateful for you for having me on this podcast, and I'm grateful for my patients for teaching me so many things, and I'm grateful for my staff for helping me take care of my patients. And there's just I overflow with gratitude. I mean, there's so many things to be happy about that there's almost no time to be sad about stuff.
Beautiful. I love that. Gratitude rampage you just went on. I love that. Well,
Yeah.
I've got vitamin D for you and your work. I can't wait to have another conversation with you because I know you're always learning, you're always doing new research, and maybe next time we could talk more about
Yeah, we didn't talk about VO2 max, my new
VO2 max.
favorite
Yeah,
things.
we'll bring you in next time. We'll dive deep. Maybe we'll do it in person when you come down to Miami next time. We'll do it here at the Keto Camp
Absolutely.
HQ. We'll put your website down below. We'll put the Affirm Science website as well with the coupon code, your social media. You have a great YouTube channel. We'll put all of that down below. And thank you, Doc, for being who you are and being so committed to not just men, but the world of health. Thank you.
Awesome. Well, thanks for having me on. I really appreciate it.